Right there. So yeah, welcome to the Lunch and Learn. Today on settings in the Zedmed Clinical. Please make sure, like usual, that you've got your microphone muted there. You can see it on the little toolbar here, the second icon on the top left there. Just mute yourself there so we don't have any interruptions to the scene there. You could also use that little orange arrow at the top there to minimize your GoToMeeting window as well. All right, so if we're obviously going into Zedmed at the moment and heading into the clinical records section, into clinical records. So what we're going to be doing is going through a number of the multitude of settings that are available in your Zedmed Clinical. It won't be an exhaustive list. There's lots of different settings there, becoming some of the most common, some of the most useful options there. Potentially, if we've got time at the end, we might be able to cover some extra ones that you may have specific questions on if we don't cover them as we go. So very popular in Zedmed Clinical, where most of the settings lie. Under the Tools menu here, we've got My Options and Global Options. Now, Global Options is generally set up by the practice manager, and probably just set once or not often edited there, whereas the My Options, so Global Options changes things for everyone. That's various settings that other people won't be able to change, but the My Options here changes the look and feel for the particular doctor who's currently logged in to Zedmed Clinical. We will, because of these different options, they do refer to all sorts of different pieces around Zedmed Clinical, so we may have to duck in and out of Zedmed of the options a few times there. So what we're going to do, let's first go into the My Options there, the bit that people are more likely to be going into. So you may need to come into this if you're setting up a new doctor, for instance. Many of the options are good defaults, but there's some other ones that are not defaulting there. So this General tab here, there's a lot of various options here. The first two options, Pathology Details Form, so Referral Details Form, and Pathology Paper Request Prompt. Now, these sections here, for when you're running a referral for a particular patient. What we might do here is I'll close out of this. I'll open a random patient for you. Here we go. And you'll see if we go into we start an encounter for this patient here. And go into the referrals section. Once we've made a referral, this particular window that pops up here, that was one of those settings there. Let's just temporarily close that and go back to the settings here in My Options. That's the Pathology Details form. And then after we've submitted set up all of the referrals and we go to print them out, the system will pause and say, have you remembered to put in either the pathology request paper or the radiology request paper? Those are options that appear up on the screen. At many sites, you'll probably just have taken these options for granted, but you can switch them off in the site here. Like I say, with many of these options, the defaults are often things that you might not even ever want to change, because at most sites, you will always want the system to pause so that you can put in the pre-printed pathology request paper or radiology request paper. That's the second option there. We've got the third option here, for instance, CRS close prompt. That's, for instance, if you go to close out of Zedmed, it double checks that that's what you're really meant to do. So all sorts of quite ordinary options we take for granted. Show audit records. That's a bit of a funny one. I've noticed that on at some sites there. My recommendation is for most doctors, you have audit records off. Audit records will be extra details that will appear down here in the history view for a particular patient. So let's see, I'm not sure whether there's any audit records for this one. No. So this is if somebody's, so they're not details of the actual encounter. They're just if somebody's been fiddling around and changed some of the problem tabs or things like that. Ideally, you only really want to see the current notes on the particular tab. So like as in you would, let's see where there's a better example than that. If somebody had been changing the title of this particular problem attached to the patient a few times, you wouldn't really want to see them make a whole, all of the different spelling errors and this and that they'd put in. You just want to see the final one there. And that's what and there you go. There's some of the audit ones there where things have been created and removed and everything. You really just want to see the final one, but that option is available there. My recommendation is that you leave audit records off, but it is something that you can, even if you've got it off, you can just click the little paper symbol there to temporarily turn it on. A problem quick select there. That was the option that, once again, not an option that one commonly sees at sites set up. That's so that for a particular patient, let me close this one here. If we start a new encounter, it suggests the existing issues that this patient has, and maybe the patient has come to see us about one of the existing ongoing issues, and so instead of having to set up the tab and attach those problems, we can just jump straight into them from here. That was the problem quick select. We've got the patient close prompt. So it's really this is the patient close section. So if you have that selected, it will automatically attempt to close patients when you do things like opening a new patient, or if you're opening patients from the waiting room. So you would tick this one if you want it to try and close patients. If normally you have multiple patients open at the same time, you will leave that unticked there, so you can have multiple patients at the same time. That's the patient close prompt. Show graph values. Don't know whether there's any graphs on this particular patient here. Measurement graphs. Let's see, blood pressure, for instance. Well, anyway, on these graphs here, that particular option will show the actual numeric values on the graphs instead of just showing the outline of the graph. This is a bit more of a easy to understand option here. The show main button captions along the top of the screen here. You could tell it that you don't want any of those phrases below it where it says like open patient, open family, close patient, and so on. If you want the screen to just be a little bit cleaner there, you can leave those off. It will always, you notice that if we hover over the icons, it will show the text anyway. So you could just, to make the screen perhaps a little bit busier, you can turn those captions off there. In the same way, as you saw, if we open up this encounter again, you see, because my screen is a little bit small here, I've turned off the writing underneath each of these captions here. Particularly for GP practices, you might have so many of these buttons here in the current encounter that if you leave the captions switched on, you'll have that funny little mark at the end there where it goes, the buttons go onto a second page. So often you could regard those captions as a bit like training wheels in a way. that could be good to have on at the very start, or if you just get into the habit of drifting your mouse over the top of those buttons there, you'll find out what the text does anyway. So that's the same between the main buttons up the top there and the encounter buttons up there. So as you see, you can turn them off individually. At the moment, I've got my show main encounter button captions on, but my encounter button captions off. That was the section down here. We don't really need the next couple of options there. Problem criticality. When you're setting up a problem for patients, bouncing out of that section there, you're defining a problem for them. Might be diabetes, for instance. It is possible to, if we had that option set on, we'd be able to set a criticality level for those for each particular issues, how critical it is for them. That criticality will stick with the particular results, the particular problems there, and so you can sort the issues by problem criticality on that list there, so the most critical problems will appear at the top of the list. The default ICPC search to show problems/symptoms only. This is another one of these ones that, regardless of whether you have it ticked or not, you can change the option when you're actually using the functionality. So if we go into the problem section of Zedmed, if we're looking up issues here, so you see on the far right-hand side here, so this is us using the predictive search to select a problem, this particular tab in their encounter. On the right-hand side here, there's the option just to see problems, symptoms only. As you see, it's a much longer list if we allow it to show us all different sorts of things that match the phrase test, as opposed to if I tick that again, it just reduces it to a shorter list there that are specifically problems and symptoms. So that's one where you can, it just sets the default for that there. Back to the options again. Yep, default viewing enhanced results, PDF or RTF. Normally you'd want that set. If you've been sent a result, an electronic result that's in PDF or RTF form, you'd want to see it that way. I suppose if your computer didn't have Adobe Acrobat on it, you might want to leave that unticked so you'd still be able to see the results. And also the bottom one here, show a prompt to create an event summary on ending an encounter. That's a My Health Record event summary, so that if you are connected to My Health Record, when you end the patient's encounter, it'll automatically prompt you to upload a My Health Record event summary. Next, we've got the number of problems in My Recent Problems. That's once again, if when you're associating a problem to the particular patient, we've got My Recent Problems here. It will show that by default, it's going to be showing the last 100 issues you've assigned to people, just to keep the list nice and easy there. Two popular ones that almost always when we come out on site or do training over the phone with doctors, we change the font size. It's actually we normally just come out and just set that straight to 12. 8 tends to be a little bit small for most people, but yeah, so 12 is a good font size, we think there. It just defaults to 8. The problems summary view. So that's on the left-hand side over here. As you can see, the summary view of list of issues by default. This is obviously there's another one where this is just the default it's set to. It's setting by onset date. Change that to any of the other ones, including problem criticality, as you would like. Similar ones there for the other summary views. how the medications are sorted, text date added or last prescription date, the measurements view there as well, which way to sort those. The default waiting room order, remember that's not for the office side of things. The waiting room order, that's your personalized waiting room or the doctor's personalized waiting room up here. By default, what's the order that they see for the patients there? So that's the default order there. Attendance time is got one when the patient's actually attended. See, there you go, or you could make it appointment time. Default summary view, whichever one of these comes up by default. By default, it'll automatically show the results just for when you open a patient. Printer settings, you could add default printer settings. I'll show you if we have time a little bit later. There's a section you can configure the printers. Hopefully that shouldn't be too drastically different for each different doctor. By default, the printer, it'll attempt to use the printers connected to whichever particular computer the doctor is currently using. Show last 10 consultations in history view. You can see peeking around behind here. By default, showing the last 10 consultations. And you can have a specific default template that you're setting up for this particular doctor that overrides whatever other defaults you may have set up for this particular clinic. As we say at the top of the next column here, images. You might have noticed if you've opened any images in Zedmed, they automatically expand to the full size of the screen. Not everyone wants them so huge, so we can change it there. And we've got a variety of different options down here that will pop up dialogues when you open a patient, if they're like pregnant, breastfeeding, elite sports person, and so on, age greater than, obviously you need to tick them in order to enable them. So all sorts of little warnings there, recalls due, overdue for particular patients in particular situations there, overdue childhood, immunisation schedule, all of those. And they're all options that pop up when you open a patient. Preferred laboratories, even though some laboratories will be the preferred laboratories of your particular clinic, for a particular doctor may prefer a different pathology or radiology lab, so they can override that here. If you leave it as blank, they should just get the preferred clinic for your particular premises. Clinical billing wizard, this will usually start on site default here. It's just so at the end of their encounter, it should automatically pop up the billing wizard. But remember, the billing wizard is only used if you've attended somebody from the waiting room. If the doctor's attended something from the waiting room. So that extra little bit, if you haven't attended them from the waiting room, if you just opened them as a patient and started the encounter that way, you won't be able to send back the billing to reception via the waiting room. So I'm not sure that they really needed to have an option in for that, but it will warn you there if it can't use the billing wizard. So obviously you would always want that option on there to say, wait a moment, you're going to have to let them know, let them know yourself of the billing. Chronic disease module, whether to have that on there. And you can actually have a countdown timer as well there for the consultation timer, that it automatically beeps after a certain amount of time that it counts down. Can't say I've usually noticed sites using that. I think people are usually just happy to have the times counting up there like it is at the moment in the background. That's the first tab there, obviously a lot on that screen there. Prescribing defaults for when you're using the prescribing module inside the current encounter. The default options in these are all pretty good anyway. Defaults to regular drugs. You don't want it defaulting, such as hints if you hover over. normally, unless you're only prescribed, you only have your very specific list, or small, very specific list of medications, you probably wouldn't want it defaulting to your favorite list of drugs, your list of most commonly prescribed drugs there. But for certain specialist clinics, I guess, where they're perhaps only prescribing maybe 5 to 15 different medications ever, you might want that defaulting to your favorite list there. All sorts of other things. Yeah, fairly generic options here. Most of these options, you just leave the defaults. Drug interactions, automatic check, stuff like that. An important one on the right-hand side here, this is a new feature here, that if this specific doctor wants the safe script to be able to work, not only do you need to make sure that the site is set up with one of the e-prescription methods, not only do you need to make sure that their doctor is subscribed, is registered for that, you need to come into this screen here and click the Enable Pre-Check. So that's the bit inside Zedmed, apart from the e-prescription installation, that's the bit inside Zedmed that for this says, hang on, this specific doctor is in fact registered for Safe Script, and so that will trigger the process that will go and check run the Safe Script pre-check. As it says underneath it, yeah, you must be registered before selecting this option. So quite a popular option right now. Document handling. Once again, this is another one of those ones that's used when printing out the referrals or the doctor referrals there. Just mostly setting the defaults. You should pretty much always have send electronically to all electronic recipients ticked there so that it will attempt to send to them electronically. And notice that some of the options here, sometimes it'll say print a copy for each paper recipient, or if you're in the habit of attaching a lot of CC doctors in on the particular referral, you might want this set to just print one copy there. This is the options found when you've gone into a referral. You're writing a referral letter in here. At the end of that, it'll, and writing the referral letter to the particular doctor, it'll pop up that exact same screen where you can change some of those options if you're wanting to do something a little bit different from the default. So it'll pop up the same screen again, and you could untick electronic recipients or change what kind of printing that you want for that particular, just in that specific case. Another popular option, this last one over here, function selections. This is where you can choose which icons appear during the current encounter. So as you see, most of these, particularly for GP clinics, you probably have most of these switched on. You don't need the add problem or delete problem in the middle there. They're the same as the plus and minus to the left of the defined problem there. But for specialists, there could be quite a few of these indeed that you'd be wanting to turn off, particularly ones perhaps like pregnancy or diagrams, templates, even some sites you might be wanting to turn off prescriptions. Just makes the list nice and neat. And remember, if you have a variety of different clinicians at your practice who have different needs, this specific list isn't for the whole practice. This is just per doctor. So you could have some doctors, I was dealing with a practice the other day that had some GPs working at it, so they would need all of these options, but other specialists, so they could turn off a whole bunch of these options to keep that list of icons nice and neat. Obviously, if you've got far fewer icons there, you could always come back to that first option here and switch back on that show encounter button captions. If perhaps you've only got 4 icons left there, and so you could just turn on those the names if you want. But either way, remember, if you hover over them, it will show you those, the text for them, just like that. Yeah, a good idea to do that per doctor. Those were the options that are specifically set up for on a per clinician or per doctor basis there. That's the tools, my options. We've also here got the global options as well, which are the ones that you won't need to be changing as often. These are the ones that for a normal doctor or a normal, most members of your staff, they probably will be locked out of this section here. So this is usually just controlled by the practice manager, and this changes some settings for everyone. So obviously a variety of different settings here. In the general tab here, obviously the first section of each has always got a lot more options on it. The other ones have got much less. So the dispensary active, it is possible to set up a special printer just for the dispensary if you've got one there. So you'll get the options when you print out the prescriptions to send off to the to print it out to the dispensary as well. Pre-post dated scripts, secure ICPC, free text problems. Most sites allow free text problems, but perhaps if you've had a problem in the past where every doctor was writing a completely different text for all of the patient's issues, and so that it became a bit hard to do reporting, maybe you might want to turn that option off after the thing that I'll show you a little bit later on, where you would reclassify all of those text problems there. You got the option whether to require the reason for encounter or problem name. At some sites, generally at a lot of GPs, you require at least problem names and reasons for encounter. That's the section here. But at some specialist clinics, they don't have that requirement. All fairly usual. Medicare spray-on script, use clinical billing items in the wizard. Yep. Whether to have chronic disease module, whether to use coded RFEs. We'll come back to that in a little moment there. So if you've got that ticked, that gives you the option to use coded RFEs. Some sites use that, some don't. That's in short, that's where you've got, instead of free typing the RFEs, you have the option to pick from an existing list of them. Allow free text problems in my recent problems. That's where you might not want doctors to be picking a variety of the free text issues that they've already put in there. And allow forward dates for referrals. The default problem onset date, accurate to year. If you recall this section here, so when we're going into a problem for a particular patient, and you'll always be wanting to put an onset date down the bottom here. By default, your clinic may be just set to year. That's where you could just type in a year. But for instance, if you're wanting to prompt the doctors to always put a specific day, that's that particular setting that we're looking at the moment, where it will default to day there. So it'll always prompt them to put in a specific day. They could still go back and just put a year in instead, but at least it could prompt them initially there to put in a date. And that was that section there. There's some sections there for the patient education. That's a bit more complex. We'll probably have a specific lunch and learn specifically on that section there. And some of the e-clinic stuff there that I'll show you shortly. Communications. Most of this section here will be specifically set up by Argus, Promedicus, HealthLink, and so on. They will come in here and set up some of those options when they're enabling their systems on your site. The My Health record, once again, some of these things with the NASH serial number and everything, either a combination of your IT or Zedmed support staff will be setting this up when your site's being set up. Letters and templates in here, a few good default templates. For instance, setting up a default reference letter for your particular site. A lot of sites will just modify the actual template for the reference letter, so they won't need to come in here and change it. But if for some particular reason you'd created a second reference letter and just for the moment you're wanting to switch it over, click on the magnifying glass there and pick the new option from the list of templates. If you recall, we had a lunch and learn a couple of times back, specifically on the templating system there. You can put in a default letter subject. Usually, though, we find that that subject line will be changing from doctor to doctor or from practice to practice. You could potentially put in a prompt there saying something like, type condition name here to prompt the doctors at a particular time to put it in there. However, if they don't notice, I suppose that particular letter subject could go into the patient file. Remember, the letter subject on a reference the doctor's creating doesn't actually get sent out externally, it just gets put into the patient file. This is also where we set up the specific templates used for the antenatal records and the pregnancy summary report there. Scanning, once again, like many of these options here, not something you should need to change all that often. Maybe at the very start, or if you change your whole network round or get some fancy networked scanners, things like that, that's pretty much the only times you need to come in and tinker around with the scanning options there. Usually you probably wouldn't want to come into that, so I won't talk too much about it now. The results section here, this is for your receiving electronic results. And remember, this is across all of the clinicians, not just whoever's currently logged in. So on this screen, unlike the other screens, we've got the small amount on this screen here, import results every 5 minutes. But we've also, if we click this extra tab here, so we're in global options, results, and the other one here, there's a number of options. Looks like quite a busy screen, but what if I can break it down here? We're setting the quick buttons. So I'll show you, if we go into the results inbox section here, here we've got the results up the top of the screen. We've selected one there and we can see the contents of that particular report, that particular result down here. You see right down the very bottom, now not all sites use this, but there's a number of different speed buttons, they call it, quick buttons that can do things for this particular encounter. Some sites don't use those buttons at all. They just have the clinicians or the reception nurses, whoever operates this, right click on the particular result, and use update result. An update result, if you've used this section at all, you'll be aware you can send this particular result to other doctors or send them to the nursing team or the reception team to contact the patients and so on. You can SMS the patients and give details, or send a message. If you're going to be sending it through to the nursing team, you could put important little details in there. So this screen, some sites just use this screen here. But if you've got a lot of just really regular things that you need, instead of needing this screen, you can set up these speed buttons down the bottom here. These speed buttons could be things like routine appointment. So if you press routine appointment, that could take the place of opening up this screen, making sure it's set to routine, sending it to the nursing team and saying, please make appointment. Something like that. Instead of doing all of that, we could just click on routine appointment and it would know all of those settings, or urgent appointment to do the same and mark urgent and maybe make, put the note, please make urgent appointment, so on. There's a variety of different buttons there, but those buttons you could configure differently for the different practices, because maybe at some sites, it's not the nursing team you want to send them through, it's the reception team, or perhaps even the administrator team, or send to a specific doctor. So these buttons here, these are like bookmarks, quick links, macros, we call them speed buttons, where you can change what each of them do. So if we exit that section there and go back into global options, and head back into the results one here, Each of those speed buttons is connected to one of these sections here. So button number 1, button number 2, button number 3, and 4. And so we can go into one. You can see some of these buttons are only relevant for people with full inbox rights. Some of these buttons will only appear for people with limited inbox rights. So if we edited the abilities of one of these buttons, you can see by default, and you could change what it says on the button, it will automatically, when you press on this button, it will perhaps mark this result as urgent. It will send it to the nursing team and put the note, nurse make appointment urgent onto that result. So that will create a speed button. It'll set up all of those options there. Remember to put on the button the text of what you want, what it's actually going to be doing. Put that in there. But like I say, you've got those several different options there. Generally, full inbox rights will be for the doctors. The limited inbox rights might be for the nursing team or reception, depends who you give access to there. So just to recall, those are for setting up those speed buttons down the bottom of the screen there. Let's see, global options again. Which other ones did we have here? That was in the results section, hidden under the results, second results tab there. Some summary, some general categories there used for the prescription module. Medications usually last 28 days. Now, if you're familiar with the dosage calculator, you need to use the tools in the top right section of the screen there, top left section of the prescription screen. And if you don't, so that Zedmed could work out how long that the medication's supposed to last until. If Zedmed doesn't understand the particular dosage that the doctor's put in, it will default to assuming that the medication is going to last 28 days there. Here are the default options there for the prescription module, regular drugs, and so on. E-prescribing, once again with the safe script here, you will obviously have ERX or MediSecure set up for the safe script. Defaults for uploading to the immunisation register, some templates for the chronic disease management, and you could, practice managers can load in links that get added to the library menu in this section here. So that's the tool set. So the tools, my options, which was just for each individual clinician, so you can change your own settings, or global options, which would be across the whole practice there. A couple of extra little options here. So in the same tools menu, we've got the printer setup section here. Most of the time you'd want these left to default, but from time to time you may have to go into them, and if you've got some problems, you might have to specifically set which printer you're wanting the printouts to come on. Normally, default will mean that this particular Zedmed will print out to the printer connected to this particular computer. That's what that default just means, whatever this computer would normally print out to. We've also got in the clinical setup section here, we've got the RFE codes. Remember I was saying before that instead of free typing text for the RFE codes, you could have a predefined set of codes for the doctors to quickly select. That's in clinical setup, RFE codes there. You can add extra new ones there. This could be a good thing to go through and set up. Add the code, both the code and the description will appear in the notes there. Let me just move this across. So the code and description both appear in the RFE notes there, but any default notes will automatically get added into the encounter notes for that section there. It could be a little bit of a template there. All of these are available to all of the doctors. So it could be, if you pre-populate the list there, doctors can quickly add in some common reasons for encounter, like rash there. I just needed to press RA and it came up there. Obviously, you can have that just as an option there to be able to use that or not, particularly for sites where the it's a standard thing all the time. You could leave that said. The address book, if we come down into the address book section, clinical setup address book. Once again, the address book at your particular practice is specifically populated just for your practice. Here's a default set here. Remember, with the address book, you can normally search by any combination of name, suburb, speciality, and so on. But as you're setting up particular doctors or labs here as well, we've got labs. Anyone, all of those contacts would appear on this list. If we're setting up a particular lab, adding a new lab into the system, obviously pick the particular kind of lab, pathology, radiology, up the top there. Depending on how you pick it, it'll make the screen look a bit different. For labs, obviously there's a variety of details you can put there. Most important bit, obviously, is the name at the top there. But if you come further down the page here, particularly for labs, you want to specify which particular paper type that labs are using. So there's a whole heap of pathology. These are hard-coded in there, radiology and so on. If you're having problems with the way they're printing out, you might need to check this section. You could also mark this particular laboratory as the preferred one for this particular lab. Say a crucial section that we get lots of calls about there, that paper type there. From time to time, depending on your printer, you might need to play with the vertical offset, but hopefully not. Close out of that section and open one of the doctors. You'll see this particular one, because we've selected referral doctor there, it's blank down the bottom. You'll also find this referral doctor section may be populated by the receptionists from the front end as well, who've been attaching them on referrals. You notice that it obviously doesn't have the paper type, seeing as this is a doctor rather than a lab. If you're wanting them to be able to receive referrals electronically, you'd come to this messaging section here, and they hopefully will have advised you of their contact details for electronically receiving referrals and so on. That's the address that you put into this section here. The section up here is just their normal email address, but the system will attempt to send them details through this special eSend address here. This is where you've got Argus, Promedicus, HealthLink, and so on. Obviously, on the right-hand side, you can set up all sorts of physical details for their location and so on. You can, instead of needing to have the doctor multiple times in the address book, you can use this Add New button down the bottom here, which gives you a whole extra page for the doctor here as well. So let's save that one there. And then you should be able to switch between the two. Which doctor was that? Yep. So there you go, got the main location, and I can switch to the other hospital there. So you don't need to have the doctor multiple times in the address book. You can have them there and just switch between the addresses as you need to. And also back in tools here, you've got the pathology test groups. You will have noticed those if you go into the prescribing module at all, that this is where instead of prescribing the tests one at a time, you'll be able to create batches of tests. That's something we commonly cover in the doctor training, and I presume it would have been in the clinical overview we gave a couple of weeks ago. Examination template editor. This is the examination module here. You can create your own extra templates. These are the ones that are like this section here where you can quickly click on these options to add encounter notes in there. So you can make your own through that section there. And recipe drugs you can put into the system through this section as well. You can also do that through the prescription module as well. Another useful option, just before we finish, we've got the ICPC Problem Mapper here. Now, you might need this occasionally if some of the patients, there you go, is to map non-coded problems to ICPC. So commonly, if you had referred earlier to, at some places, the doctors prefer to free text all of the issues, all of the problems that the patients may be having. That can be a problem for reporting. If the doctors maybe use a variety of phrases and a variety of different spellings for the same conditions. So you could use this particular tool here, the ICPC Problem Code Mapper, to find all of the different issues that the doctors have listed, that all the different problems, and map them to specific ICPC terms. So once again, this is under Tools. Where did I put it there? Utilities, ICPC Problem Mapper. There. So you can see in this specific case, there's some free text issues that have been put into the system here. What we would do, we'd right click on the particular free text one that they put in, like just randomly chronic or diabetes might be a good one there. Find the problem code. By default, it'll only guess at the first 3 characters because maybe people had mistyped the rest of it. Search, and then we could pick a particular issue that we want every occurrence of this particular phrase to be mapped through to. So in a normal site, this might say 52 or whatever. So we could say, okay, every time it says diabetes, what that actually means is diabetes type 2, for instance. So we could pop that in there, say map these codes now, and that'll convert every instance in the problem section of just diabetes being said, convert that to the official phrase, diabetes type 2, to just standardize it to make sure that all of your reporting works a lot better there. So let's perhaps set something for chronic here, because that's one that's more obviously wrong. Oops. See, everything by default starting with CHR. We could have gone back and typed extra letters in there if we wanted to reduce the list. So maybe it's chronic obstructive lung disease. Obviously, if you are finding that your doctors if you're wanting to use this section, you're finding that your doctors have used a wide variety of things and you've got a huge issue there, what you can do is you can use this times used section here to just get the more problematic ones, the ones that they've used maybe 100 times, to the top of the list there, so that you can get the ones that are the phrases that they've used a lot more often up the top of the list there. So you can deal with them first before moving on to some of the others. Remember, so you set the ones there, and then you can say map these item codes now. Yep, and then it's going to go through the system and change all of those up. So hernia is the only one left over now. I think that's about our time there now. I'll just have a quick pause to see if we had any questions before the end. If you could just type them through into the chat section there. If they're straightforward enough, I'll answer them now. If they're not, I'll answer them offline after this. Excellent. Well, it seems that's our session for today. Thank you very much for joining me today, and I hope this was useful to you. Remember to register for any of the future Lunch and Learn webinars. We've got the topic up on our website there, the various different topics, and email any feedback to implementation@zedmed.com.au. Once again, we've got a variety of different sources that you can go to for information. You can register, you could log on to the client login section of our website under the top right-hand corner, the login, and get manuals and software and things there, and even extra templates. You call up our support desk Monday to Thursday, 8 till 5:30, or outside hours, there's for urgent inquiries, there's support there. Thank you very much, and I look forward to presenting to you another time. Have a great day.